Patrick, after your own diagnosis with prostate cancer, you decided to make it your personal mission to inform and educate other Afro-American and Afro-Caribbean men in South Florida about their risk of prostate cancer. How has this been working so far? What have been the ups and downs?
Well, there's been a lot of ups in the sense that I've been able to go into a lot of churches and just groups of men. I've actually spoken to a group as large as 200 people. And another up is that in most of the situations, their spouses are there. So that's a positive. Some of the downsides about this is there are so many men out there who've just never been screened. And what I'm finding out is that the first time they get screened, it's too late. You know, I go and I ask them, I just stress the point that they should go get screened. And then as a follow-up, I get a phone call from somebody saying, hey, listen, it's too late. It's in my bones already. And this is the first time they get screened. But I'm just going to keep pushing forward. You know, there's a lot of work to be done out there.
What are the critical issues that you emphasize for men of Afro-American and Afro-Caribbean ethnicity? Have you been able to enroll their wives and partners as allies in your mission?
The critical thing for that particular group is the fact that we are the greatest risk. We're going to be exposed to the disease more often, and we're going to die from it more often, and they need to be aware of those issues. There's a false sense of security because by the time you have symptoms, you know, you go symptomless, and if you at the stage where you get symptoms and that's what is going to bring you in to see your physician, it's too late. Now, as far as the wives are concerned, you know, most men don't want to hear anything about this, but if you get their wives involved, I've been in so many groups where I speak to the men and their wives, and the wives are the ones that say, thank you for saying this, I'm going to get them checked.
Have you found that there is any particular message that will get men from these racial groups to take their risk more seriously today?
Well, there are a couple of things. First of all, I try to stress the family. I make it a point, you know, most of you men here have you know, wives and kids that you want to be around for, and there's no reason to die from this thing prematurely. And secondly, I always stress the point that prostate cancer, if it's the reason for your death, it's a very painful process. And no one wants to die from prostate cancer when you really shouldn't die from it if you get screened.
Does the primary care community that serves Afro-American and Afro-Caribbean families in South Florida really make enough effort to ensure that their male patients are aware of their risk level and getting appropriately tested?
It's not so much their fault because their hands are tied. Most men don't go to the doctor unless they're sick. And if you walk into your doctor's office and it's because you have a cold or you have a cough and a fever, that's not the time when this is going to be addressed. There's also, I would say, limited access. So a lot of men in those communities just don't have insurance. They don't have access to health care. So that's the first step. They don't make it through the door. And unfortunately, a lot of the time when they make it through the door, it's too late.
How important is it to you that we are seeing the potential beginning of healthcare reform? Do you think this is really going to help these issues?
I think it can, but we have to start making a lot of noise like the women do for breast cancer. We've got to get the word out. You know, women are talking about breast cancer, and there's always walks and all these rallies. We don't do that for men in prostate cancer, and that's how we're going to start to spread the word so we can get the help.